Hi everyone. Imagine a medication that not only helps people manage their diabetes, but has also sparked global conversations about weight loss, health, and even how we think about food. That medication is Ozempic. Today, we'll explore what Ozempic is, how it works, and why it's become one of the most talked drugs in the world. So, in order to understand the how Ozempic work or the mechanism of work of Ozempic, it is important to first examine chemical structure of Ozempic. So, the molecular composition of semaglutide consists of 17 carbons, 22 hydrogens, 4 nitrogens, 4 oxygens, and a single sulfur atom. The now let's move on to the peptide composition, okay? So the peptide composition. Ozempic is a synthetic analog of the human GLP-1 peptide with 31 amino acids. Its design improves stability and prolongs half-life, enhancing therapeutic effectiveness. But how does Ozempic work? Just how? Like any other medication, how does it work? What is its mechanism of action? So, Ozempic is a GLP-1 receptor agonist, right? So, it mimics the natural hormone GLP-1 that is released in our gut after eating. Ozempic stimulates insulin secretion in response to glucose, decreases glucagon secretions, which prevents the liver from releasing too much glucose, and slows gastric emptying that contributes in weight reduction, leading to improved glycemic control. As we know, Ozempic is not the only drug that is a GLP-1 receptor agonist. There is other ones like liraglutide, like dulaglutide, etc. But Ozempic remains the one that provides greater weight loss and less frequent dosing. Moving on to the effects of Ozempic from the chemical perspective. First, the pharmacodynamics. The pharmacodynamics refers to how Ozempic affects the body at a cellular level. It mimics the incretin hormone, GLP-1, which regulates insulin secretion and glucose metabolism, promoting effective blood sugar control and balancing it really well. The interaction with GLP-1 receptors. So Ozempic binds to GLP-1 receptors in the pancreas, stimulating insulin release in response to elevated glucose levels. So when the glucose levels are high, Ozempic stimulates or boosts insulin production in response to these elevated glucose levels. This interaction enhances glucose-dependent insulin secretion while reducing glucagon levels, vital for diabetes management. The impact on blood glucose levels. Ozempic effectively lowers blood glucose levels by increasing insulin sensitivity and reducing hepatic glucose production. Clinical studies indicate significant A1C reductions, demonstrating its efficacy as a diabetes treatment. As we know, the one thing that is so important in diabetes is remaining or keeping our blood sugar levels all balanced and controlled. So this is the impact of Ozempic on the blood glucose levels. The weight loss mechanism. A lot of patients that or just Ozempic users have noticed that by the time they are using Ozempic, they have lost a significant amount of Wait, so why? How does this work? So Ozempic promotes weight loss by slowing gastric emptying and increasing satiety so that it longers post-meal fullness, which make us more full for a longer time, which this is the one that like decreases our appetite and reduces food intake, making it a beneficial thing for patients with type 2 diabetes who are struggling with obesity. These side effects, just as any other type of medication, every single medication has its own side effects. So, what are the side effects of Ozempic? While Ozempic is definitely effective, it does really good things. It may cause side effects such as nausea, vomiting, and diarrhea. So, understanding these effects is crucial for patients and healthcare providers to manage potential discomfort during treatment. Now, let's dive into the effects of Ozempic from the layman terms. How Ozempic works. So, Ozempic functions by imitating glucagon like peptide GLP-1, which, as we said, is a hormone that promotes insulin secretion when blood sugar levels are high. This helps regulate blood sugar levels effectively, making it easier for patients to manage diabetes. The benefits for diabetes management. As we know, one of the most important things for diabetes patients is to keep their blood sugar levels all balanced, all good, you know? So, Ozempic is the one who gives us this. Ozempic significantly lowers blood sugar levels, reduces the risk of cardiovascular events, and aids in maintaining healthier hemoglobin levels. Patients often experience improved glucose after regular use of Ozempic. The weight loss simplified. Ozempic helps individuals lose weight, as we said previously, by reducing appetite and increasing feeling of fullness after meals. Many users report notable weight loss, making it an appealing option for those struggling with obesity. Some common experiences of users. Users of Ozempic report diverse experiences, including significant weight loss, better blood sugar control. However, some may face gastrointestinal side effects such as nausea or diarrhea at the start of the treatment. Now, let's look at some key takeaways for patients. Ozempic can be a powerful tool for managing diabetes and assisting with weight loss, but but it's crucial for patients to work closely with healthcare providers to monitor effects and adjust dosage as necessary. Understanding Ozempic's risks, abuse, and addiction. Abuse and addiction. Let's focus on those two words. Misuse. Potential for misuse. Ozempic can be misused for unintended weight loss, leading to off-label use among individuals not prescribed the medication. To your knowledge, Ozempic is a prescribed medication. So if it's not prescribed by your doctor, you cannot buy it from any drugstore. So Ozempic is a prescribed medication. This misuse poses significant health risks and underlines the need for stringent regulations. Warning: signs of abuse. Signs of abuse may include excessive dosage intake, becoming dependent on Ozempic, seeking multiple prescriptions from different doctors since you can't get it from just one. They will try to go and visit a lot of doctors in order to get them from all of these doctors, and emotional changes linked to drug dependence. Recognizing these signs is crucial for timely intervention. So, if you know anyone who is using Ozempic, please keep an eye on them, on any signs of abuse, to help them before it gets too late. This psychological dependence, I mean, this is like a really important thing. Our mental health is important, so the repeated use of Ozempic for weight loss can lead to psychological dependence, where individuals feel compelled to continue its use beyond medical necessity, even after like their body has already achieved what it needs. They always continue to use it like their life depends on it. Like if they stop using it, they will die or something. So this dependency can impact mental health significantly. So watch out for them. Regulatory considerations. Ozempic is subject to strict regulations due to its potential for misuse. Regulatory bodies emphasize the importance of monitoring prescriptions and upholding standards to prevent abuse. The importance of medical oversight. Continuous medical oversight is essential for anyone being prescribed Ozempic to mitigate risks of abuse. Regular evaluations help ensure the medication's effectiveness while monitoring misuse. So now we've seen how Ozempic works, why it's different, and how it's shaping the future of diabetes care. As a diabetic myself, this was Alae with you. Thank you for your attention. This was Alae with you from Good Medicine. This presentation was only for educational purposes and not a substitute for professional medical advice. Always consult a healthcare professional for personal medication guidance. Thank you so much and have a good day.